So the medical society has evolved quite a bit during your years of membership. When did you join?
I joined in 1973.
Okay.
And I had no choice. My practice required me to join. I joined two OBGYNs who had a practice in Haverhill.
Uh-huh.
And one of the things in my contract was that I would agree to join the Mass Medical Society.
Interesting. I joined the Fallon Clinic, and when I joined, they did not require it, but they said we all belong. And, you know, there is a reimbursement for your dues. So there was a culture that encouraged belonging to organized medicine. That's interesting that you bring that up.
The other thing was that, I don't know if this happened when you joined, but when I joined, I had to go take a test.
We didn't do the test, but we had to
bring my diploma with me, which
Yeah.
of course was in a frame like this.
Yeah.
And that test was more of a hazing than a test, but I remember it quite well.
It was a residual of the days when the medical society was the credentialing organ.
Exactly.
Before there was a board of
Exactly.
registration of medicine, there was the medical society, and they didn't quite give it up at that time. They have since.
So once I joined, I was totally uninterested. I couldn't have cared less. And my picture of, I was a pretty radical person. I mean, I was marching against the war in medical school, against the Vietnam War.
Mm-hmm.
And when I was in the public health service, we were wearing black armbands that my wife Lori sewed for all the people, and we wore them over our USPHS uniforms. So I was a pretty radical guy. And I looked at the medical society as a bunch of old white guys who, you know, like it was a guild.
Mm-hmm.
So I had nothing to do with it. And one day, I don't know if you know Vince Russo, but
I do.
Yeah. So one day I'm standing in the operating room and Vince Russo comes. He says, "Joe, I have this great job for you. It's going to give you tremendous visibility, and you're going to get more patients, and you don't have to do a stick of work, and all you have to do is show up at a meeting." I said, "What meeting?" He says, "The Essex North District Medical Society." I said, "Well, what is that?" He said, "It's a division of the Massachusetts Medical Society." He says, "All you have to do is show up, and you're going to become secretary." So I show up at this restaurant, and on every chair is this pink ballot, and there's my name printed right on the ballot.
Mm-hmm.
And I became secretary. And of course, the first thing I discovered was there was a hell of a lot of work, because you were the guy everybody had to bring their diploma to, for one thing.
Huh. Okay.
But in addition to that, you know, you had to organize the meetings, you had to take minutes, you were in charge of the treasury as well, and you were a delegate to the House of Delegates, and you know, so it was a big job.
Mm-hmm.
And then I learned that, and at least in the Essex North District, once you became secretary, you had to stay as secretary until you found another sucker to take the job.
Was Vince the secretary?
Yes. And Vince was the secretary. So that is how I got involved in organized medicine. And just at that time, the Medical Society was having a retreat, and they brought this business guy in, and I was brand new. I'd never been to any meetings, so I just told them what my impression was, and of course I seemed like this young guy who just didn't know what the hell he was talking about. And but I was a loudmouth, and I still am. And you know what happens to loudmouths? As soon as they need a volunteer for something, they take you. So that's how I got involved.
Mm-hmm. And you very involved in the House of Delegates, Speaker.
Yeah, I was. I was Speaker, yes, and I was Speaker at the time that we had another retreat, which was in the western part of the state. We had a retreat, and we decided to. Well, that was the retreat I had hired Paul Breslin for, and Paul had, without my knowing, had interviewed all the state legislatures, the governor, the people from the insurance companies, anybody that the medical society dealt with, and then also, unbeknownst to me, had done a survey of the membership. And everybody had the same opinion of the medical society. Basically, that it didn't do very much, that it seemed irrelevant, was one of the descriptions, and we realized that we had to have a change of some kind, and so we went through this process where we developed the House of Delegates instead of what we used to have, which was called the Council. The Council, first of all, there'd usually only be one or two things to vote on. It was very disorganized, and when you wanted to propose a change of any kind, usually what would happen is the leadership would come to you and they would try to negotiate something where you got almost what you wanted, but not quite if you didn't introduce the resolution, that kind of thing. So we changed it from a top-down situation to a bottoms-up situation, I think, greatly. And I think that that's probably the most important thing I ever did for the medical society, was running that retreat.
So this is interesting because, again, I keep going back to the notion that you started life off as just focused on one patient, and it seems like you've gotten this whole idea of systems down pretty well fairly early in your career.
Well,
what
the reason that
direction?
happened is because our hospital tried to force us to join a health plan called North Shore Health Plan, which was run by Blue Cross Blue Shield, which was a capitated plan. Was the first HMO that was coming to our area. And I listened to it, and it sounded awful to me. And so I said, no, I can't do this. I campaigned on the medical staff. Listen, guys, let's not get into this. We're going to lose all control, and this just sounds like a terrible idea to me. And I made enough of a noise about it so that the hospital decided not to do it. And then I started seeing the writing on the wall, because the Tufts Health Plan was developing, and there was Pilgrim Health Care, and this thing with the physicians that called me up and wanted to have me give them a discount and a room.
Right.
So I organized the physicians in my area and started an independent practice association. And then we interviewed all the HMOs, and we decided to go with Tufts. And so for the first several years, we were just exclusively Tufts, and then we started contracting with other health plans, and that IPA is still going today. And that's how I got involved, because then I started having to learn how to negotiate with a health plan to sign a contract for all these physicians who weren't even in my practice, and I'm signing a contract about how much they're going to get paid.
Right.
So that's really how I learned all that stuff, was from that experience.
School of Hard Knocks.
Yeah, and then because of that experience at the AMA, I joined the Council on Medical Service. I was elected to that council predominantly because I'd had all that experience in my IPA. I had a lot of experience with negotiating contracts, being concerned about how patients are affected by these contracts.
So you started your career off in a group of 3 OBGYNs.
We ended up at 9.
9, okay. And talk about the evolution of your clinical practice regarding the kinds of days you'd have, the kinds of problems you'd see, how they'd be treated.
Well, first of all, I was the youngest guy in the group. My first day, I had a wonderful senior partner who would not allow me to see a patient until I walked around with him for 2 days and watched him treating patients, how he listened to them, how he spoke to them, what his tone of voice was, how he inserted a speculum, all this stuff that nobody ever cared about before, for me anyway. And the other thing was I looked incredibly young. And it got to the point where I could walk into a room and look at the patient's face when she first met me and know this was not going to work because I just looked too young to her and she was uncomfortable. So I got pretty used to saying, I can tell you're uncomfortable. Let me just get Dr. So-and-so to come in and take care of you. So that was the beginning of my practice.
Sure.
And the other thing that happened very close to the beginning of my practice was I got left alone for 2 weeks while these 2 guys were involved in a lawsuit. So I got a lot of practice experience from just being alone for 2 weeks. I was covering everything for 2 weeks. Usually we did all our OB in one part of the day and all of our GYN in another part of the day. And we were on every third night and every third weekend, and we took some vacation. And then as we got bigger, we insisted that we all have 4 weeks of vacation and 2 weeks of educational time. And we also, every Wednesday morning, the 2 of us who were free would go down to Beth Israel's Grand Rounds so that we could learn something, which was also a very good experience for me. And then we started to get bigger. And we were on less frequently, but when you were on, especially by the time we got to 9,
Sure.
You didn't get any sleep.
Right.
You were there all the time. You were awake. We made rules like if a patient is in the hospital and is having any kind of contractions, you're going to be there too.
Right.
No waiting until somebody calls you for delivery. And
Did you live far from the hospital?
oh, that was the other thing. My guys, we were involved in a lawsuit. The lawsuit was about abortion. We were suing the city of Haverhill to allow our practice. This was going on before I even got there. To allow although I did the first abortion in Haverhill, we were to force the city of Haverhill to allow us to perform abortions in the city hospital. And we won that lawsuit, and about 4 months into my practice, they decided they weren't going to do their deliveries in Haverhill anymore. They were going to move them to Newburyport. And in Haverhill, I was literally 7 minutes from the hospital, 6 minutes from the hospital. So they moved to Newburyport, and I still have this patient. She was a 16-year-old gal, and she had a pelvic infection. And I admitted her to the hospital in Newburyport. I came home to my home in Haverhill about 2 a.m. in the morning, and I get a phone call. Dr. Heyman, she won't allow anybody to start the IV except for you. You have to come back and start the IV. Meanwhile, she's got 104 and she doesn't have any antibiotics. So I turned to Lori, my wife, and I said, honey, we're moving. I don't care that we only own this house for 2 months.
Yeah.
So I went back to the hospital. I started her IV. When I came home, we started making plans for moving, and I ended up moving. We had 3 hospitals that we were in our area, and I moved equidistant between all 3 of
Sure.
them, and we ended up mostly in Newburyport.
Yeah, with a group of 3, you could be on call from home.
Right,
Group of 9, not so much.
not so much.
And so the practice in OBGYN evolved quite a bit. The way patients were managed, if you were practicing in the 70s, you were dealing with a fair amount of natural childbirth and that sort of thing. Did you? how'd that
Yeah,
go?
well, I had been trained to do epidurals, and when I got here, nobody would do epidurals, so I had to do my own epidurals. I did that for about 3 years until we were able to persuade the anesthesiologists. Actually, what persuaded them was when I put in an epidural, and then the patient needed a C-section, and they had to administer the medication through my epidural. You know, that convinced them that maybe they ought to start putting in their own epidurals. So that was one big change. Although for myself, I always preferred natural childbirth to any of that other stuff. I thought it was safer for the patient.
And when you started in practice, roughly how many were natural childbirth? What percent?
Well, I would say probably 80%, maybe
Yeah.
75,
And now,
80%.
what would you say it is?
I don't know what it is now.
Under
because-
20. Yeah.
Yeah.
Okay.
Wow.
So yeah, that's changed.
Oh my goodness.
Yeah. So
Oh, and the C-section rate.
what was it when you started?
I don't know. During my entire practice, it never went above 15%.
Right.
And now I understand it's going to be like 40 or something.
Well, it's
like-
32.
32. Oh
Yeah.
my God.
Yeah. I think Memorial Hospital in Worcester has the lowest rate for an academic center, and they're around 27, 28. But you're right, that changed enormously over the years.
The other thing was that I was in my residency program. There was no or very little natural childbirth. It was all give them a spinal and then forceps. So I was very, very proficient with forceps, and so that has a lot to do with why I had such a low C-section rate.
Exactly. The forceps have gone
Yeah,
away.
I know.
Yeah.
Yeah, I mean, even I was using vacuum at the end of my
Yeah.
career rather than forceps.
And when did you stop doing deliveries?
I stopped doing deliveries in October 2000. Let's see. I think October 2010.
Okay.
Yeah.
Wow.
So 8
So
years.
you did a
ago.
lot.
Yeah.
You did several
Yeah.
decades of
Oh
of
yeah.
obstetrics.
I practiced. I was in private practice for 41 years.
Yeah. And gynecology, that's evolved quite a bit.
Oh yeah.
Ultrasound.
Well, when I started, the only thing you could do with an ultrasound was measure the size of the head.
Right.
You couldn't see the head,
Count the number of babies.
but
yeah.
you couldn't. Oh, even.
Yeah.
I once had a set of triplets that I had to deliver, and I called my senior partner because all I had was this ultrasound proof that it was triplets, and he said, "Don't get an X-ray. If they just tell them you'll be upset if it's not triplets." And I did the C-section, and it was twins. So much for ultrasound.
Yeah, yeah.
But in any event, we used to do amniocentesis, diagnostic amnios without ultrasound. We didn't,
Right.
you know.
So when you started, that's where it is. And you know, as we have
And
this
also
conversation,
the
different
HPV
story.
vaccine,
Yep.
doing pap smears less often,
Yep.
Mifeprex and misoprostol, morning after pill, a lot of stuff changed. Well,
Laparoscopy.
Laparoscopy. These 2 guys were the only guys in Massachusetts doing laparoscopy when I got here.
Essentially implemented during the 70s for tubal ligations and
Right.
diagnostic.
Exactly.
That was it.
Exactly. They
Now-
taught me. I didn't learn that in my residency. These guys taught me in my first week
Yeah.
here how to do a laparoscopy. One of the things that always amused me is we were doing these laparoscopies, and then all of a sudden they started doing them at Beth Israel, and MGH, and the next thing I know, they're like the experts of the country, you know?
Right.
When these guys learned, they had to go to Hopkins to learn. They took
Right.
off and went to Hopkins to learn how to do them.
Right.